So again, my name is Lucy from Flown Initiative. We were part of the implementing partners for the Shikan tool. And just a brief about our engagement with Empower 2. So we took part in the launch of the Shikan tool, and after that we were able to receive some small funding to pilot the Shikan tool in Nairobi. And for us, we chose to work with Embasava Sacco. And just to give a brief background about the transport system in Kenya, some of the issues that I want to mention is that we have inadequate data when it comes to issues of sexual gender-based violence, and actually these create a problem for government agencies and also other stakeholders who want to come up with interventions to address SGBV and other issues that limit women and persons with disabilities from actively participating in the public transport workforce. The other thing is social norms, and this has come out so strongly since we started this conference, whereby the marginalized and the vulnerable groups actually seen as people who do not matter. The other thing is policies, looking at gray areas in policies, and for example in Kenya, looking at the Employment Act that requires employers, if you have more than 20 employees, then you need to have a sexual harassment policy, but that's not the case in the informal sector because you are self-employed and you don't have a contract. And you tend to find that SACCOs in Kenya, they have over 1,000 employees, but they do not have these policies because, again, they are not binded by anybody, and considering that they are working informally. And then the other thing, fragmented interventions. Here in Kenya, we have county and national governments, and you tend to find that sometimes they do not have platforms where they can engage. Like the county government is doing intervention A, while national government is implementing another intervention. So there are sometimes gap and also duplication of roles. The other thing is lack of sustained political goodwill, looking at low budgetary allocation to especially social issues like disability inclusion, women inclusion in the transport workforce. So that creates a lot of discrimination and also exclusion of women. A brief background about the public transport in Nairobi, where we've piloted the tool, where about half of the Nairobi dwellers use public transport, and about 60% of women do not feel safe while using public transport or working in the sector. And as mentioned in the morning, only about less than 10% of the women work in the industry, with about 88% of them having had witnessed or experienced sexual gender-based violence. And 58% of these incidences are perpetrated by male PSV crew who are mainly men. And just to mention, these incidents normally happen throughout the day, but they are more prevalent during the night. So what we did, again, we worked with Embasava Sacco, and what we chose to do as an organization is advocacy against sexual harassment. And we worked with public transport service provider, that's Embasava Sacco. And what we did with them was basically to roll out an advocacy campaign. And a brief background about Embasava: they are slowly transitioning to clean energy, and they have about 1,000 employee operators and about over 500 fleets of vehicles, and they are offering services in 4 counties in the metropolitan. And we found that this is a good target for us because we are looking at a situation whereby as they transition to clean energy, and they'll be more sensitive, and they'll be able to ensure that they install solutions, and also they'll put in place measures to address SGBV, even in the e-buses that they are bringing on board. So what we did, and of course with guidance from the tool, we conducted a baseline assessment to identify the structures that are existing within the SACCO to tackle sexual harassment. And then from there, we did a training on the SACCO board so that they can continue the conversation and also be able to come up with structures within their SACCO to address SGBV. And lastly, we roll out an advocacy campaign against sexual harassment. So from the baseline, some of the gaps that we identified is that the SACCO lacked a sexual harassment policy. They also lacked training among their operators. Like majority of the operators have never been trained. They didn't even know what is sexual harassment apart from rape and defilement, because these are like the extreme. They didn't know like touching or groping is another form of harassment. And also they didn't have data. They didn't know how many of their commuters have been assaulted, what happened to them, did they report, what did they do? So these were some of the things that we were able to find out. From that, from the training that we did with the SACCO, we saw there was an improved awareness on what sexual harassment is in the board, and also they were able to know the available referral pathways within Kenya, right from reporting to the police, seeking medical support, and also following up at the court of law. They were also sensitized on the existing law, for example, the Sexual Offences Act, what it says about sexual gender-based violence, and what they need to do. The other thing that happened during that sensitization workshop was that the SACCO committed to strengthen their structures to address SGBV within their operations and also the management. They also committed to publicize a number where survivors can actually report these incidents. After that, we were able to roll out an advocacy campaign as mentioned. And what we did, we organized a concretion workshop with the SACCO so that we do not impose solutions to them. So what they proposed was we strengthen their reporting channels, also requested us to help them publicize their reporting mobile number, also requested that we train the operators on SGBV. Apart from that, they also requested us to support in designing and also distributing Matatu stickers with advocacy messages highlighting different forms of SGBV referral pathway, the law, and also the She Can Tool QR code, so that in the future and in case somebody in the bus and they want to maybe get more information or read about the tool, they can be able to access it through the QR code. So these are some of the stickers that we distributed in the Matatus. And as you can see, they have their phone number, where if you're assaulted or harassed in a Matatu, you can be able to call directly to the SACCO. And then the other thing we have up there, the QR code to the She Can Tool, where maybe a commuter who is interested or a practitioner can be able to access information on how to maybe take a decision or actually implement the tool. We were also able to support in strengthening how the SACCO responds, prevent, and also support survivors, in that we help them design an OB book highlighting different sections where they report the incident, and then it has a section also for them to highlight the kind of support that they are offering to the survivor and aftercare services that they are actually providing, or the mechanism that they have put in place to ensure that these survivors are helped. It also has a clear referral, SGBV referral pathway, like if someone at the OB receives that case, if they are not fully trained or they are not aware, they can be able to see the path where if you receive a case, the first thing you do is to take this person to hospital. From hospital, you take them to the police station, and then from there, you keep following up to ensure that they receive the necessary support. We also created an advocacy banner that's mounted on their office, and this is actually to create that sense of sensitivity and also to hold them accountable, because you cannot put stickers and you're not walking the talk. And so based on the full engagement with Embasava SACCO, we were able to identify opportunities that mobility partners here can borrow and not only work with Embasava SACCO, but with other public transport companies. And one of the things was supporting the SACCOs to work on sexual harassment policies, because this is something that they don't have. Also, customer service charters, looking at having a system where commuters can be able to share their experiences as they use these particular companies, and then also a code of conduct for the SACCOs to ensure that all their operators know what is expected of them, the do's and the don'ts. The other thing is training. You tend to find that some of the perpetrators continue to harass other people because they do not know that this is actually harassment. So training them, creating more awareness, and rolling out advocacy campaign, both online, through radio, TV, that will really be helpful. And again, something else, even the members of the public, and especially women, are normally harassed because they do not know that this is harassment. And again, in Kenya, we have a tendency of normalizing harassment. And most people say, I'm used to that. So what are you telling me? So again, questioning that and challenging that need to be done. And then we also highlighted about a lobby for policy reforms, and especially at the national level, whereby right now we do not have a clear policy defining sexual harassment in public transport. And in most cases, it's confused to customer service. Like here, a conductor can just touch you, and for them it's customer service, but they really don't know that this is harassment. The other thing, and we are really fundraising towards this, is that we want to relaunch our Report It, Stop It platform, just to increase survivor support. And this is a platform whereby the survivors can be able to share their experiences, report incidences, and then we are able to provide data to government agencies and also other mobility partners who want to take action against sexual gender-based violence. And the platform will have a live map, and as a commuter, you can be able to see where these incidences are happening, what time they happen, what kind of incidents, and from there you are advised accordingly, maybe what areas to avoid and what areas you can roll out interventions to address SGBV. So from there, I think I'm done.